The Universal Care Plan is paving the way for people to have a personalised care plan that focuses on their life as a whole. People's lives are complex, and we know that approximately 80% of people's health is determined by factors such as where they live. By listening to patients and tailoring care, we can make a meaningful difference to their health outcomes.
In my Universal Care Plan, when I'm having a future appointment, I want to be included from the beginning, listened to, respected. If I need to be to go with me, I want that in my Universal Care Plan.
So the reason why I would want the Universal Care Plan to be put in place would be when I'm going into hospital, I have to constantly repeat my story to each physician, each nurse, etc. And then, for example, when I'm admitted, again, I have to repeat my story again. But if I had something like the Universal Care Plan in place, the story would be there, and it would be a question of, do I have anything to add to it, rather than to repeat the main story?
It will enable everybody involved in supporting somebody to really see them as a person first, as a person with a condition that affects them in different ways. In John's case was, if you could play some music, that would be great. Often he would enjoy something like Ain't Misbehaving, which would bring the house down, and that would enable the clinician to really do the work that they're there to do.
I get good video adjustment now, because in the past I couldn't read the letters I get from the doctors about my appointments. They would like looking at answers on a page. They wanted to send me a text message and a reminder text message for all my appointments. I even missed appointment yet. Now, video adjustment, that made a difference.
I think the important thing is to understand both the doctors and the patients. The doctors need to understand the patients, and the patients need to understand the doctors. If the doctor understands what you feel matters to you, then it's a lot easier to treat you, because then they know where you're coming from.
We're also expanding this level of care through the Universal Care Plan to other really important conditions. The first place for us to do this is with sickle cell disease, where knowing in advance what care can be tailored to people's needs is really important.
It means that the person who's accompanying them doesn't have to keep being asked, and what about this and what about that, and what happens when this is needed, so that there's a way in which that will also relax a family member who's there, who can concentrate on the here and now and actually be very helpful to the clinician.
When I'm using the Universal Care Plan, if I'm moving to another place in London, I want to make sure all my information about me follows me and always keep up to date, because it's very important. If I do move to another doctor's, another hospital, information about me is there ready. And when I see the doctors, they understand what I want.
For the first time, personalised care can be delivered at scale across the whole of London.